I'd like to call to order the meeting of the Insurance Benefits and Ledge Committee for Thursday, the 14th of January, 2021. Terry, would you like to call the roll?
Yes, this meeting is being conducted virtually, so I will do a roll call of the trustees to confirm attendance. Mr. Knox, Mr. Santos, Ms. Gray,
Yes.
Mr. Bernstein,
Here.
Mr. Oakham,
Mr. Oakham's here.
thank you. Mr. Moore,
I'm here.
Mr. Kehoe,
Present.
Ms. Zapanta, Mr. Pryor, Mr. Harris, Chair Robbins.
I am here.
Staff participating in the meeting includes CEO Santos Kryman, AEO JJ Popowich, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, from Retiree Healthcare, Cassandra Smith and Kathy Magida, Stephen Murphy, Paul Sadro, and Richard Ward from Siegel. If you have a comment or a question on any item, please use the Zoom chat to be pasted in queue. At this time, we ask all meeting participants to mute your mics until you're ready to speak. And now we may proceed with the agenda.
Thank you very much. Item 1A is approval of the minutes of the committee meeting of December 10th, 2020. I need a motion.
So moved.
Are there any changes to the minutes?
Was there a second?
Seeing none, here we go ahead.
Was there a second?
I'll second.
All second.
Okay.
Hit second.
Ms. Gray? Ms.
We're
Gray?
gonna vote.
Yes, my internet is bad all of a sudden.
Mr. Moore?
Yes.
Mr. Oakham?
Yes.
Chair Robbins?
I'm an aye.
The motion passes unanimously.
We're on item 2, public comment. Terry, do we have anyone from the public wishing to address the committee?
No, I don't have any requests.
Thank you very much. We're on to item 3A, the engagement report for December 2020. Mr. Liu, you have the floor.
Thank you. Good afternoon, Chair Robbins and committee trustees. So just some items of interest for you this month. The Public Policy Institute of California has released their statewide survey on Californians and their economic well-being. They have 2 broad categories of findings. One is on public perceptions, and on that, more than half of Californians are approving of the job that the governor and the legislature are doing currently in this crisis. But the coronavirus is still front and center, especially with the numbers as they look in California, especially LA County. There's also a lot of economic pessimism. According to these surveys, only about a third expect improvements in the next 12 months, and about 4 in 10 expect that in the next 5 years. And lower income Californians have been especially hit hard by the pandemic. So there's also pessimism about whether children would grow up better off than their parents, and also about growing economic inequality. Also, a large majority of Californians also say that racism and discrimination also contribute to economic inequality. As far as their economic experiences, about 41% say that they or a household member have had reduced work hours or pay in the last 12 months, and about 27% said that they got laid off or lost a job. Saving for retirement and the cost of housing is also something that about a quarter of the people worry about almost every day. Most people have pretty good job satisfaction, but lower income workers are less likely to report that. And also a large majority of workers say that their job has sick pay as well as healthcare coverage. About a third of workers say that their workplace offers union membership, and 8 in 10 agree that it's important for workers to organize. And then lastly, a majority of Californians favor various economic policies, such as job training, childcare, governmental health insurance, the earned income tax credit, and also free college tuition. But proposals like the universal basic income, fewer favor that.
Call from Cecilia City of.
Barry, you may proceed.
Okay, so the next item on Cal Savers, just a couple of stats regarding California and Illinois. Seems the opt-out rates have gone down. They've been about 30%, but they've since dropped since December. And then since November, as far as Illinois is concerned, they've had about 75,000 participants with assets about 40 million in their secure choice accounts. And then in California, there's about 67,000 participants with about 20 million in the accounts. Now, the next item is about workers who are tapping retirement savings as a last resort. As you know, this pandemic has caused a lot of economic distress. So since the pandemic began, about 2.1 million people have withdrawn money from their retirement plans, according to the 5 largest 401k administrators. In a normal year, about 2% would take a hardship withdrawal, but Fidelity reports that about 5.5% have taken one this year. The CARES Act made it a little easier for people to withdraw money. So for example, they can withdraw up to $100,000 without the traditional 10% penalty. And income tax is spread out over 3 years, but the CARES Act also allows people who took a distribution to also repay that within 3 years to avoid taxes. At the same time, many people may not even have a retirement plan as a source for withdrawals. According to some sources, only about half of the households in the country have a 401k or an IRA. You may have also heard the common advice about having 3 to 6 months of emergency savings, but you know the pandemic has sort of upended that. That's also led some employers to start some programs to help their workers set aside cash for emergencies, you know, through payroll deductions that would avoid, you know, for example, tapping retirement savings for emergencies like this. And then the last item involves a study by the National Institute on Retirement Security about the inequalities in retirement savings between men and women. And so some of their findings include the fact that generally women over age 65 have a lower median household income than men. They generally earn less over their careers. And then past age 80, women are also more likely to be widows. And when it comes to retirement income, those on the bottom, you know, a fifth of the income scale with less than $20,000 are generally more dependent on Social Security, whereas those in the top 20% who generally have about more than $80,000 in income receive most of that income from either defined contribution plan earnings or property income. And also caregiving strongly affects retirement preparedness for women as well, who are more likely to be caregivers than men. And so some of the recommended policies to deal with some of these issues include adjusting Social Security spousal benefit and also providing caregiving credits under Social Security, having more generous family leave policies, also removing the age limits on the earned income tax credit so that more people can reduce the income boost. And lastly, of course, creating a universal savings vehicle so that you know, as many people as possible can, you know, save for retirement. So that concludes my report, and I'll be happy to take any questions.
Does anyone have any questions for Barry? Mr. Santos?
Comment. Mr. Wu, I was informed that Representative Freddie Rodriguez and Jim Cooper, state representatives, are co-sponsoring the legislation of COVID-19 presumption.
Yes, I haven't got caught up with that yet, but I will take a look at that. We're also having a SACRS Ledge Committee meeting tomorrow, which I'm sure that will be discussed as well. And I can also follow up with our lobbyists about that.
Feel free to call SEIU. They're working on this.
I'm sorry, I didn't catch that.
If you need to, you can contact SEIU. They are working on this. Vito, Vivian, what's Vito's last name?
Oh, Vito Trelia. Yes,
Yes, he's on it. His designated staff, public relations to staff working on that. So he will be happy to, I'll give you a full briefing on that.
absolutely. I'll also touch base with him as well.
Thank you, sir.
Any other questions or comments? I found the first part of your report particularly depressing, Barry. I was reading that last night going, holy smoly, this is bad. So, especially when I'm looking at the house across the street from me that just sold last week, what they got for this place was absolutely insane, even by my understanding of what's going on in real estate. So somebody's got some money because they're paying some incredible amounts of money for some houses that aren't that much. So anybody else? Item 2, activities report for December. Cassandra?
There's really nothing to report on the activity report. One thing I did wanted to say is that I was listening to your meeting this morning and you guys were asking about or wondering what was going on with the city of Long Beach and the city of Pasadena. It gave me opportunity to go on their websites. Both of them are telling their residents that if they have healthcare, that they should check with their providers first before they make an appointment. And I've reached out to our carriers to find out what they are telling our carriers. I know Kaiser, for one, is very good about sending out calls and texts and all letting members know that when they'll be eligible for the vaccine. And so they confirm that that is the method that they will be doing, but stay tuned for our other carriers.
Yeah, Cassandra, Ron Oakham, did Pasadena indicate that they have the vaccine and where one can get it? And
No, they're actually telling them that they are waiting on vaccines. If you go on their website for the people that are 65 or over, it says at this time they're waiting on vaccine supply and that they will make appointments available when the vaccine becomes available.
Does anybody know if the pharmacies have vaccines yet?
They're all working together with the providers to give those vaccines. So that's why they're referring them to their providers.
Okay, thank you.
I get most of my local shots at my local pavilions, and I walked in there about 4 days ago and asked them if and when they thought they were going to have the vaccine, and the response was, we don't know and we don't know. So they seemed to be optimistic a month ago that they would be giving the inoculations there, but what they told me 4 days ago was quite a different story. Interestingly enough, my wife and I both got an email last night from Memorial Hospital in Long Beach, where we both have been in and out of the last couple of years for various medical procedures. And they reached out to us and said that they would contact us, that they've got us on a list. And when they get the vaccine, they would contact us so we could go there to get it. At the same time, the City of Long Beach Health Department does have a website. We got on that and we actually got on a wait list there. So I think what's kind of squirrely is nobody really knows what's going on here. I mean, everybody's kind of playing by a different set of whatever. So, and from everything I've heard, it's probably going to be the Moderna vaccine, not the Pfizer vaccine, at least down here. But then again, it just seems to be all over the map.
Well, Les, I know at the hospitals here, they're giving the Pfizer. And I think doctor this morning said he got the Pfizer at SC. So who the hell knows anything at this? I'd rather take the Moderna.
I would too, actually. I've heard about both of them and that would be my preference, but they're both pretty darn good.
Yeah.
Anything to add, Steve, on this or what?
No, I think your observations are spot on to everything we're seeing, which is, again, there's been a lot of inconsistency in the transition from the federal government to the state governments. And again, that's being borne out in terms of how quickly it's being pushed out. What we have heard earlier this week is that the Biden administration is likely to, again, draw down that threshold from age 75 to 65, which would increase the numbers of eligible. And I think the idea is they're going to push out all those vaccines that have been on reserve for that second booster shot to try and push that out. But I think we're all reading the same thing and there is no definitive answer.
Steve, what do they do when they run out of the second shot?
Yeah, if I had that answer, I'd be working in Washington. Still, I do not know.
No, you don't want to work in Washington. Steve.
No, I don't.
But respectfully, in California, that's not the problem we're having. We've given 1% of the population the vaccine in a month. We have a distribution problem more than we have a vaccination problem right now, according to the information I'm reading. And honestly, we should be pointing the fingers at ourselves because California is sitting on vaccines and not getting them into arms.
They're sitting on 5.5 million of them, Alec, because they roughly 10 million, and they only vaccinated 4.5 to 4.7. So something's wrong.
So I suspect based on the conversation, you had some of this back and forth earlier this morning. I'd say just to kind of build on Alan's last comment, again, the idea of going to mega sites for distribution like Dodger Stadium or Disneyland and others across the country is certainly going to be something else that evolves. I think we have questions about how they're going to track one who goes through that system, how they go back and get their booster shot. And again, there is an administrative cost associated with the vaccine. The vaccine itself is at no cost, but the administration fee would apply to the medical plans. So again, how they're going to track and push that information around, I have no idea. But again, the idea, how do we get this into people's minds as possible is ideal.
I think the biggest problem, if you do that, now I think they're waiting, you're waiting 15 or 20 minutes if you have a reaction, and they have the ability to counteract the reaction. I don't think I haven't heard anybody, my friends, have reactions, or the docs that I know, but we'll see.
Anyone else? We'll go to item C, LACERA claims experience. You're up again, Steve.
Gladly, I'm going to transfer that benefit to Paulie, who's going to walk us through the experience today.
So on the first slide is premium and enrollment. Slight change there. Medical premiums up about 115,000 and 20 retirees. No material changes in the dental and vision. On the next slide, we have claims experience by carrier. No major changes for Cigna or Kaiser. Anthem's showing a 1.7% increase on a rolling 12-month basis, and that is down from 2.6% in the prior report, mainly due to Anthem plans 1 and 2. We progress one slide further to...
I got one question, Paul. On that Cigna, I think you said it was up about 8.2. Are we getting, because of, I know they're not getting any turnover, are we getting hit hard on the premiums because we don't have turnover? People are not joining that plan, most probably.
We're not seeing anything abnormal in terms of the premium renewals. They are slightly higher. However, that population is decreasing over time. So actually the total cost of that plan is coming down. But as those participants age, they become higher risk. And so we do expect to see some higher premiums in that plan.
And just as a reminder, the Cigna plan is, for anybody that remembers, is kind of the old Ross-Lewis members. So that is a very mature population, and we'll see a decline in the overall population continue over time.
So we can progress one further to Anthem claims and experience by plan. On an overall basis, we're seeing a 1.5% increase in all the Anthem plans combined. This would combine both the Medicare and non-Medicare plans. That is down from 2% in the prior report, and that is mainly due to experience in Anthem plans 1 and 2. We can progress one further. So this is Kaiser utilization. Kaiser did not provide any updated experience since the last report, so this is exactly the same as last month. So we can
Paul,
progress
if I
one
could just
further.
interject real quick. Looking at this experience, just recall that the bulk of the initial COVID activity or lack of activity due to the suspension of unessential services is really kind of in that 2019, 2020 number. So we're looking at March, April, May, June, and July. So that's when we were probably down the most in terms of activity. So that's that'll be an artificial low.
Trinidad, go to.
So we can progress one further to high cost claimants. Anthem claims above the pooling point are at an average of $34. And this is a decrease of $13 from the prior report. And this is mainly due to Anthem increasing the pooling point by $50,000. So it reduces the amount above the pooling point because of course that pooling point is higher. Cigna claims above the pooling point increased about 10% from the prior report, and this was due to some new claims. Once again, this is a smaller population, so we would see more variance in that from report to report. So we can progress one further to rebates. Rebates were updated for the third quarter of 2020, which slightly increased the rebates in the most recent 4 quarters that we have available to 110 per retiree per month, and that is up from 106 in the prior report. We can progress one further to dental and vision. No material changes here from the prior report. We are seeing these large decreases in per capita claims on a rolling 12-month basis, and over 10% of that is due to reduced utilization due to COVID-related suspensions. But really no material changes from the prior report. So that's a complete overview of all of the experience. So if you have any questions, we can go back and take a look at some of the other slides if necessary.
Questions for Paul or Steve? Seeing none. What else you got, Steve? Anything?
We touched on, oh, go ahead.
Yeah, I just, the claims, Steve, seem to be great. I mean, and I think those rebates are greater than they were before. Is that correct?
Yes, they are.
Thanks, Paul.
Okay. So Steve, we got a ways to go, but what do you think about March? You'll get renewals?
We were in the midst of the renewal process, which we began in October. So that's been progressing. We're actually going through some final numbers now, and we'll have some last discussions with each of the vendors that are scheduled for next Thursday. So we'll spend about an hour with each vendor, just going over kind of the renewal process, any remaining questions that exist, and finalizing negotiated renewals. So we should be in great position to bring the renewals to you in February.
Should they be somewhere between 2 and 3?
That's our expectation.
Good. Good. I got a smile out of Cassandra there.
I had a straight face until you did that one. So yeah.
Hey, Steve, I have a COVID vaccine question for you. I noticed when my wife and I got online and registered to get on the wait notification list down here, one of the things they wanted was our insurance information. So I'm just curious, these vaccinations are supposed to be free to everybody in the country. At least that's what I've heard. Mm-hmm. But why would they be asking for our Medicare information as well as any supplemental insurance information, i.e. Anthem Blue Cross too? No. What are your thoughts on that?
That's a great question. It's complicated because I think what we're seeing is, yes, the vaccine itself is free. The distribution of it, there is an expense associated with that. And again, given the fact that we've got primary inoculation and a subsequent booster, I think the total cost of administrative is probably ranges between $50 and $70. I'm not sure specifically. So why they're collecting the insurance information, because that administrative component will funnel through Anthem or Kaiser, all those plans. So that's why they're asking.
Okay.
Will the insurance pay for that, Steve, or should we pay for that?
Insurance should pay for it because your out of pocket as a participant should be zero.
Okay.
Anything further, Steve? Federal legislation?
Oh, thanks so much. We talked about COVID, but I think the one thing I think everybody's aware of, the public health emergency has been extended through April 21st, 2021. So that's going to include a continuation of testing and treatment at 100%, in addition to the vaccination we just covered. I did reference the fact the Biden administration is looking to push out more of the vaccines and trying to find methods of getting more shots in arms, if you will. So that's going to be ongoing. And then last item, at the last meeting, we talked about a number of prescription drug rule changes that the Trump administration has pushed through kind of at the tail end of their term. One was the most favored nation model for Medicare Part B drugs, which are typically administered in the office. The intent is to lower those costs and also kind of manage the administrative costs associated with those. And the other one is the elimination of rebates for the outpatient drug benefits. It's likely the Biden administration is going to take a hard look at both of those. What ability they have to change them might vary by both. There are different methods that they have to attack that, but that's probably going to come up. So I think we'll be talking about this kind of well into 2021.
Anyone have any questions for Steve? Hearing none, we're on item 4, items for staff review. Terry, is there anything?
There's nothing to report.
Nothing to report. We are now on to good of the order. I'll start with Mr. Harris, since you're the first person I see.
Nothing here.
And Mr. Moore.
No, I don't have anything.
Vivian.
Yes, I just want to give kudos to Cassandra Smith. Where is she? She's not on the screen anymore. Oh, there you are, Cassandra. I just want everyone to know that whenever our members reach out to me, and I'm sure for you, Les, you can call Cassandra, text her anytime, and she gets back, and she always helps our members. So I just really appreciate you, Cassandra, because I know you're extremely busy as, you know, the director of our care, but you always take the time to explain things to our members, and you take the time to follow through, and I totally appreciate you. So thank you so much.
Needless to say, I have the exact same experience with Cassandra and her staff as well. So, Mr. Holcomb, anything? Mr. Bernstein?
Nothing for me today.
Mr. Kryman?
For me, sir. Nothing for me, sir.
Mr. Kehoe?
I got nothing.
I'll just stop there and say, anyone that has anything, you can speak up. Seeing or hearing nothing, that concludes the agenda for today's meeting. How about a motion to adjourn?
You can say without objection.
Without objection, we are adjourned.
Have a good one, everyone.
Bye.
Bye.
Happy New Year.